Hello, my name is Vanessa Clairvaux, and I'm presenting my case analysis for Medical Terminology 101. In summary, a 54-year-old man has come in complaining of dizziness, along with a right temporal headache and a constant ringing sensation in his right ear. These symptoms began gradually about 3 weeks ago and have been progressively worsening. He described his dizziness as a sensation of veering to one side, having difficulty keeping his balance, and sometimes needing to hold onto a wall or railing for support. He also hasn't been able to ride his bike during this time. He does have a 10-year history of migraine headaches controlled with sumatriptan, as well as a history of concussion and post-concussion syndrome for about a year after a high school injury. The ringing in his ear does not include any sensation of pressure or pain, no initial contributing factors with his pulmonary, cardiovascular, or gastrointestinal systems. He has no surgical history, no medical allergies, and does adhere to a low fat, low cholesterol diet, occasional alcohol intake, and frequent exercise on his bike. Certain patient demographics, such as age, race, gender, are super important to include in medical case summaries because biological factors, such as a woman and man having different reproductive systems, are important. Or race, like sickle cell, that is a disease more prevalent in individuals of African descent. Or finally, age. Some conditions are associated biologically with an age range, like menopause or Alzheimer's. And these statistics and research behind these are very important when considering diagnoses. Analyzing medical terms. First is rhinitis. Rhin or rhine refers to the nose, that is the word root, plus itis, that is the condition indicating inflammation, that is the suffix. Rhinitis refers to inflammation of the nose or the mucous membrane, and he does experience rhinitis seasonally. Paresthesia. Par, abnormal or beside, that is the prefix, plus esthesia, that is the sensation or feeling, that is the suffix. Paresthesia refers to abnormal sensation, often tingling, prickling, or burning, that occurs without an apparent cause. This patient did deny these sensations during our assessment of him. And lastly, labyrinthitis. Labyrinth refers to the inner ear, but specifically the labyrinth, that is the word root, plus itis, that is the condition indicating inflammation, that is the suffix. So labyrinthitis refers to the inflammation of the labyrinth, and this was presented as a differential diagnosis for him. Medical abbreviations. So one that we saw during his exam was blood pressure reading. Blood BP is blood pressure. 120/70 is the systolic and diastolic pressures. mmHg is millimeters of the element of mercury, which is the unit of measurement. When we see L-S spine, we're referring to the lumbosacral spine. This consists of the lumbar vertebrae, L1 through L5, and the sacrum. When we see MRI, that is referring to magnetic resonance imaging. That is a medical imaging technique that uses strong magnetic fields and radio waves to create detailed images of organs and tissues inside the body, and it is very loud. Differential diagnosis. So at this time, the likely differential diagnosis is acoustic neuroma. Acoustic refers to the ear and hearing, as the vestibular nerve is involved in hearing and in balance. Neuroma is swelling and a tumor that arises from a nerve or nerve cells. This patient has a history of concussion and 10 years of headaches, which could have compounded to this current development. And outside of his headache and dizziness, the main symptom he's mentioning is consistent ringing in his ear. Though it's rare, acoustic neuromas are more common between the ages of 40 and 50, and this patient is 54 years old. Larger tumors can also cause facial numbness, weakness, and swallowing difficulties, which he has denied all three of these things. However, he does have a number of symptoms that are not, he doesn't have a number of symptoms that are prevalent in the other diagnoses. So it's possible he might have a smaller tumor at this time. Another observation from this case he mentioned is symptoms began gradually about 3 weeks ago and have been progressively worsening. Acoustic neuromas are generally slow growing tumors. I do have a final page in this presentation citing my resources. Significance of medical terminology. It is crucial to have a solid understanding of medical terminology in a healthcare setting for various reasons, including the sensitivity and differences from one word to another, one diagnosis to another. Understanding how medical words are built now, if my case subject had conditions with combining forms, including cephal or cardio, then I know there's a lot more to consider with his brain or his heart. And depending on the suffix I hear, I can receive quick information on how that part of his body is doing, feeling, reacting, etc. Understanding terms being communicated from my team allow for the appropriate level of urgency. In this case scenario, he has seasonal rhinitis, inflammation in his nose, which can be dangerous, but if it was encephalitis, inflammation in the brain, this calls for more urgency, and it's a different conversation in regards to his health safety moving forward. Acronyms are just as important. Example, if a patient has a DNR, we want to make sure we respect their preferences. Or a chart listing PO versus NPO, respecting their preferences and the doctor's recommendations. But ultimately, effective use of medical terminology ensures not only for the condition, but the treatments recommended align with our never-ending progressive medicine and research. Thank you. Reference page for case analysis and medical abbreviations.